to the recording serving. All right, so looks like it's recording. Wonderful. Well, let me then begin the webinar. And I want to say a happy mid to late afternoon for those of you in Western Canada and evening in Eastern Canada. My name is Keil, and I'm very grateful and honored to be here with you. I've developed the webinar, and I will be facilitating this webinar tonight, Suicide Awareness and Prevention in the Canadian Veterinary Profession. Take a moment and change a life. So I am going to move on to the next slide, just one moment here, and just a bit of housekeeping. All of you upon entry are automatically muted by WebEx. So if you do have a question throughout the 45 minutes or so that I'll be speaking, please type it in the chat box. And the chat box will either be over on the right-hand side of your screen, or you may need to make it appear. And to make it appear, just hover your cursor over the middle portion of your screen at the lower part of your screen, and the chat bubble will appear. It looks like a word bubble. And then if you click on that icon, the chat box will open to the right-hand side of your screen. And then just chat in your question. I have an amazing colleague who is monitoring the chat for me. And as I get towards the end of the presentation, and likely we'll have about 12 to 15 minutes of and a downtime at the end, that I'll take any questions that you do have. All right, so before I move any further into the webinar, I'd like to take you back about 27 years. And that was my first year of veterinary school, and I realized that veterinarians are wounded healers. And it was 10 days into my first year of that school, and one of the second-year students who had been missing for most of that week was found. And unfortunately, it was his body that was found at Niagara Falls, and he had suicided. And then fast forward to my third year at vet school, and a resident took the euthanasia solution and an IV set to one of the agricultural dairy barns and took her life by suicide. And those suicides hit me at the time and still do really hard. I get a visceral reaction even now thinking about them as I recount the narrative to you. And I wonder what unenduring mental pain and anguish were those two people experiencing that suicide was the only option for them. And why didn't we, the people around them, notice the warning signs? Why do these beautiful, intelligent, amazing people fall through the cracks? And I also, thinking back, felt really hopeful for my life as a vet student and expectations of being a veterinarian. But I also got to thinking, what if the darkness and the pain of the mental anguish overrode my hopefulness? I know and I knew that I'm at risk for mental health disease. My mother had clinical depression. My sister is an abuse survivor and has post-traumatic stress disorder, suicide ideation and has attempted, and I have anxiety disorder. So I began to do what I do really well, which is worry. I worried for those around me, and I also worried for myself. But I thought about what they tell us on planes, which is to put our oxygen mask on first before helping other people. So I started to be really mindful about my own self-care. And I started to take mindfulness-based classes. I took a mindfulness-based stress reduction class and incorporated the mindfulness techniques into my day-to-day self-care. And then that continued beyond veterinary school. I took mindfulness-based self-compassion, and then I also, although I have 2 degrees in psychology, I'm not a licensed counselor, and I realized from my cognitive and neuropsychology training that there was a lot more for me to learn about mental health. So I took a 2-day mental health first aid course. I took a suicide awareness course called Safe Talk, and you'll be hearing contracted version of Safe Talk today on this webinar. I'm certified to teach Safe Talk. I've also taken a 2-day applied suicide intervention skills training course, which enables me to be a trained suicide intervener, so I can help people who have thoughts of suicide be safe. And then I took my own yoga practice as a self-care strategy to a different level by becoming a certified yoga instructor. And I'm happy to report that I teach yoga on a regular basis to the University of Calgary veterinary students where I live. along with their cohort of clinical teaching dogs, the beagles. We call it beagle yoga, and it's a lovely way to take a break during the day. I'm a member of the Alberta Veterinary Medical Association Wellness Committee and an advocate for mental health in our profession. And over the years, out in Western Canada, I've just been identified as someone who is willing to talk about mental health and well-being in our profession, talk about the information that I've learned from the courses that I've taken and am certified to teach, and teach the strategies to help us be more aware of our self-care, our mental health, including suicide awareness. And I'm hopeful that I am a practitioner of wellness in my everyday life, the best that I can do. So I'm hopeful today that on this webinar, I can help you achieve 3 learning objectives. And the first one is to help you identify people with thoughts of suicide by becoming alert and more alert to warning signs. You will learn one way, and it's a good way, to be able to ask people with those warning signs if they are thinking of suicide. And if those people say yes, then you will learn local resources that you can connect those people to in your community to help keep them safe from suicide. So I want to recognize that suicide can be on this webinar in a personal way. It may be that you have a person in your life, a friend or a family member or a coworker who is thinking of suicide. You may be thinking of suicide. You may have attempted, or perhaps you know someone in your life who has attempted suicide. And you may be a person who, over the years, you've lost a person to suicide. And I want to make sure that you're okay. So you have a few options when it comes to letting people know that you have thoughts of suicide. You can call the direct suicide support line. The phone number is on this slide. It's a Canadian support line. It's 1-833-456-4566 or text 45645, and you will get a live person. You can also be connected to your local distress center in your own community. And the people who are on this phone line are trained in suicide intervention, and they're empathetic, caring, compassionate people. They will not avoid or miss or dismiss your thoughts and your suicide ideation. They will be able to provide you with help. You can also go online to suicideprevention.ca to find a list of all Canadian crisis centers, and then you have the phone number for the crisis center in your own community. And if you know people who have thoughts of suicide and you want to help them reach out to safety, then do this phone call together. Or if you're a person with thoughts of suicide, think about who you would trust, someone that you feel safe with, to make this call together. I know that there can be a lot of different thoughts and feelings going on when people do have thoughts of suicide. I have experience with, including one family member who has attempted, and she recounts that prior to talking about her own thoughts of suicide, she felt really ashamed and embarrassed that she was A, having the thoughts, and B, that her brain was telling her to have these thoughts, that she couldn't get the better of her own thinking. But then after sharing her thoughts with other people, including myself, people who she felt safe with, she said it was so relieving and so unburdening that she didn't have to carry the burden of having the thoughts of suicide anymore. And then we were able to keep her safe, and she remains safe to this day and is thriving. So this is an important topic, the information that I'm going through today, and I want to make sure that you're present to it and that the people around you are present to it as well, and not be distracted by thoughts of suicide. So moving on to this slide shows 20 icons, facial icons, and it really helps us understand that studies tell us that 1 in 20 people in the Canadian community have thoughts of suicide at over a 2-week period. And the studies from the veterinary profession here in Canada tell us that 1 in 5 veterinarians and registered veterinary technologists have thoughts of suicide at a given point in time. So if this picture represents the vet profession, then 4 people, and it could be any of them at any given moment, are very likely to be having thoughts of suicide. The potential for having thoughts of suicide is part of being human. Although there may be people who have certain life experience or characteristics that make them less likely to have thoughts of suicide, no one is perfectly safe from them. Almost anyone can have thoughts of suicide. While the potential for thoughts of suicide cannot be prevented, acts of suicide, so harming oneself or taking one's life, can be prevented. And the people in this picture that these icons represent are thinking about suicide, but not yet acted on it. They're, so to speak, still in the picture. And in fact, most people thinking about suicide do not want to die. There is a part of them that wants to stay alive. And it could be a small part or it could be a large part. But for most people, there is a part of them that wants to stay alive and needs help in staying alive. There is doubt right up to dying. And the closest we can get to understanding this is hearing from a suicide attempt survivor. His name is Kevin Hines, and perhaps this name is familiar. He wrote a book called Cracked Not Broken, Surviving and Thriving After a Suicide Attempt. And in his early teenage years, he heard voices in his head, and he was diagnosed with a number of mental health illnesses, psychosis, bipolar disease, as well as depression. And these voices in his head were telling him that he was unsafe, that he should harm other people, and that because of that risk, he should kill himself. So he had suicidal thoughts for many years, and with medication and with other types of adjunct therapies, he was able to keep those thoughts in abeyance. But they increasingly got to the point where one morning, after spending a night searching online for ways of killing himself, he was very agitated, very distressed. And when his dad came into his bedroom to check in that he had taken his medications and was ready to go to high school, Kevin was hopeful that his father would notice and say something. Say something like, Kev, you look more agitated than usual. What's going on? Do you need any help? But his father didn't say anything. So Kevin went off to school, and although he continued this state of agitation and distress very visibly, even his guidance counselor, who he had an appointment with, didn't say anything. Kevin got on the bus that was going to the Golden Gate Bridge in California. And on the bus, he was even more visibly distressed because all he was thinking about was jumping to his death. Yet there was a part of him that was reaching out for help, hoping that people on the bus would sit beside him and say, hey, buddy, you look really distressed. What help do you need? And even when the bus cleared, the bus stopped at the very last stop on the line, which was at the Golden Gate Bridge. The bus driver looked in the rearview mirror at a visibly distressed Kevin and just said, hey, get off the bus, kid. Didn't even mention anything about Kevin's distress or agitation. And Kevin stood on the sidewalk and was hoping that one person would mention that he looked distressed and might need help. And indeed, someone came along the sidewalk, spoke to Kevin, but asked him to take his photograph. He was a tourist. So Kevin took his photo, gave the phone back to this guy, turned and looked at the waters and jumped. And as he was jumping, he again thought, I don't want to die. And somehow he righted himself, whether he knew he was doing this or not. He righted himself so he landed feet first in the water. And although he broke several lumbar vertebrae in his femurs, he survived. And now he's a staunch advocate and speaker on suicide awareness, and that it's okay if you recognize warning signs in someone to ask them if they have thoughts of suicide, or just ask them if they're okay or if they need any help. So this narrative of Kevin Hines tells us that in his experience, right up to the point of dying, there is doubt. And the part of him that wanted to live was stronger, and that part that wanted to live was reaching out to other people, asking for help. So because people with thoughts of suicide want that help, almost all people with thoughts either unconsciously or willingly give people warning signs that they are thinking about suicide. So when it comes to these warning signs, it's really helpful to look at them in categories. So we'll look at things that we hear someone with thoughts of suicide say, that's called talk. We'll look at behaviors, actions. We'll look at things that we pick up on the other person. Maybe it's a hunch, a gut hunch, or a feeling. We'll call those moods. And the last category of warning signs that we'll look at are risk factors. These are things that we either know about that person or that we learn during conversations with that person. So first, let's look at talk. So these are things that we'll hear the person with thoughts of suicide say. And these are just some examples. It's certainly not a comprehensive list. So we may hear them say, I'm such a loser, a negative expression of self. Nothing ever good happens to me. I don't know what to do. Those are indicators of hopelessness or helplessness. Life is not worth living. Nothing good out there. Indications of not having a meaning or a purpose to live. The sense of burden. I feel like I'm a burden on my family. It's not fair to them. They would be better off without me. Feeling trapped. I want to abandon everything in my life and run, but I don't know where. I've got to get out of this mess. I have the solution. I have to get out of here. There is something I need to do. These statements, these words can be coded for killing oneself. Sometimes they can come across as a bit of a joke, but it's these are words that can indicate that the person is thinking of suicide and even has a plan for suicide. And finally, the mental pain. It hurts to think and feels so dark. The next category of warning signs are actions. So these are things that we'll see a person with thoughts of suicide do. And again, this is just a peppering of examples here. So we may see that someone who doesn't use alcohol or drugs on a regular basis starts using, or there's increased use or abuse of alcohol and drugs. The person may withdraw or isolate from people or things that they used to spend or do things with. There's a loss of energy, a loss of appetite, general fatigue, sleep disturbances. Careless is an interesting one because careless can have two meanings. The first is that the person cared for something or someone and now no longer does. So perhaps careless about personal hygiene. Careless can also mean reckless behavior. So when my sister was having suicidal ideation, she would walk in traffic. And for those of you who live in Toronto or visited Toronto, she would walk on Yonge Street, north of the 401, very busy stretch of road, at least 4 lanes, sometimes 5 to 6 lanes of traffic. People with thoughts of suicide may show to us that they're looking for a way to end their lives, such as searching online for methods, as Kevin did, Kevin Hines. And then making preparations, giving away prized possessions, visiting or calling people to say goodbye. And this can be a tricky one for us because my sister started to make preparations with respect to giving away her prized library of books. And she was very thoughtful and careful as to who would get certain books. And for me, having seen my sister in the depths of a depression, suddenly be present in life and with life, calling people, being organized, having energy, on one hand, it made me hopeful that the help that she was getting was helping her. But at the same time, I had a gut feeling that there was something more to it. And there was certainly underlying not just suicide ideation, but having a plan to take her life. Moods are things that we'll pick up about the other person. They could be gut hunches or feelings. It could be that the person has a marked or drastic change in mood. So a person who used to have it together all the time is now crying. Or perhaps appearing more agitated, irritable, or angry. And that's how Kevin Hines showed up. And these moods can almost seem like that person with thoughts of suicide is pushing us away rather than inviting us in and wanting help. And then again, there might be a change where someone who is self-sufficient and independent is now appearing clingy and needing of us. We talked earlier about statements that would indicate hopelessness or helplessness. Things like nothing ever good happens to me, or I don't know what to do. Sometimes people with thoughts of suicide will just be a shell of who they are. So they'll appear as listless or numb or flat. And then we talked about this in the behaviors, but there can be a relief or sudden improvement in moods. And the final category of warning signs or risk factors. And these are things that you may know about the person, or you may learn about them as you have conversations over time. And the first risk factor are mental health conditions. And depression is present in 1 in 2 people in the Canadian population. And those who are depressed are 25% more likely to have thoughts of suicide. And although depression feels different to every person, some overlying themes or overarching themes of people who have depression are experiences like feeling that there's a heavy weight on them. It's difficult to get out of bed. It's exhausting. Sylvia Plath, an author who took her life with suicide, talked about the black dog of depression, how empty and hopeless, never-ending pain, feeling like one is in a tunnel that gets darker and darker and more closed in, and how depression and other mental health conditions can erode one's thinking. Substance abuse, and that could be either abuse of alcohol or drugs, is second to depression as the most frequent risk factor for suicidal behavior, and the risks increase if substance abuse occurs along with another mental health condition, whether it's depression, post-traumatic stress, bipolar, schizophrenia, or anxiety. Let me just actually, before I go to prolonged stress, let me just speak about mental health conditions in the veterinary profession. And this speaks to that first reference, which is cited on the slide. And in 2018, Merck USA sponsored a study. The lead researcher, Dr. Elizabeth Strand, who is a social worker at the University of Tennessee, and the study set out to identify the prevalence of mental health conditions in veterinarians and also the extent to which veterinarians rate themselves as having severe psychological depression. And up to 80 veterinarians from the study were evaluated to have reported experiencing feelings of depression, compassion fatigue, or burnout, and anxiety or panic attacks within the past year. 5.3% of the veterinarians experienced serious psychological distress within the past 30 days. Now, that percentage compared to the general U.S. population is very similar. It's higher, but not statistically so. But there were subsets of veterinarians who were at higher risk of extreme psychological distress. And those were veterinarians under 45 years of age, those who worked evening shifts, those who worked longer or like more or fewer hours than desired, and those veterinarians that had financial debt, personal financial debt, particularly left over from student days. Now, anecdotally, mental health disease and conditions has been severely under-researched in other veterinarian professions, such as registered veterinary technologists and support staff. And we would be naive to think that those groups of people do not have mental health conditions. It's just a matter of needing research in those people. Now, when we look at prolonged stress, that can really show up as a number of things. It could be family issues, relationship problems. It could be trying to find elder care or child care, financial issues, or unemployment. Abuse, that could be a history of abuse and trauma as a child or more recent abuse of any kind. Rejection, maybe not getting a desirable job or not getting into an academic program, rejection from a relationship. Losses can be from a relationship, a loss in a business. Could be the loss of a person or animal in one's life. And I think many of us might be thinking of clients here, either clients grieving with the loss of a pet or a producer who has to deal with the loss of livestock through a culling situation, a health herd issue. And I think of a recent barn fire in Steinbeck, Manitoba, where 800 dairy cows burned. And I think about the first responders on that scene, likely veterinarians, registered vet technologists, and the producers, and the degree to which they experienced visual trauma, but also the lived experience trauma that can catch up with people 2 to 4 weeks after the traumatic event as post-traumatic stress disorder, sleep disorder, and anxiety. Suicide experience can be a risk factor. It could be exposure to another person's suicide. It could be having lost a family member or a friend or a coworker, or even one's own thoughts of suicide. And then access to lethal means, whether it's firearms or drugs, is interesting with respect to us in the veterinary profession. A study, and that's the second citation, was published just a couple of weeks ago, which indicated that veterinarians, more so than other veterinary occupational groups, are more likely to suicide with pentobarbital. And the researcher, the lead researcher, an Auburn University psychology professor, talks about the risk factors that we have ready access to pentobarbital as veterinarians, and we also have knowledge on its usage and administration. And also that she calls it, this researcher talks about the potentially permissible attitude that veterinarians may have towards suicide, because we're often involved in ending the lives of animals, typically through suffering, or assisting the slaughter of livestock, that we may, in essence, become habituated to death. And so this results in a lowering of suicide inhibition, making us more likely then to choose pentobarbital as a suicide option. So this slide basically tells us that suicide rarely comes on its own. There are typically compounding factors. So in summary, we talked about the 4 different categories of warning signs. So what we hear, what we see, moods, and risk factors of the other person. And people with thoughts of suicide give us these warning signs, and they are counting on us to notice something about them, to make us notice these warning signs and just wonder if suicide is a possibility, if in fact these warning signs could be connected to suicide. So just taking a pause here, if you've been thinking of suicide, and if you're giving warning signs to someone, then I want you to think whom you will tell and when you will tell them, the soonest possible time that you can tell them so that you can stay safe. And do tell in the most direct way you can. So it might be something like, I'm thinking of killing myself and I need help from you so I do not do that. And if you can't decide who to tell, then you can call the Direct Suicide Support Line. This phone number is on the screen, or text 45645. And if you are with a person who is in crisis and suicidal, then ask them if they need help to make that phone call. Again, the list of all Canadian crisis centres are at suicideprevention.ca. And because I mentioned that suicide rarely comes on its own, it often comes with compounding factors. The provincial veterinary employee family assistance plans are an excellent source of help, and most, if not all, the provinces have entered some agreement with an employee family assistance plan. In Alberta, for instance, it's Homewood Health. So in recognition that this is the inaugural, it's time to talk about mental health and veterinary medicine awareness week, I've developed a number of wellness resources. They're available on the CVMA website under the Practice and Economics tab, and this information is in the public domain, so you don't need to be a CVMA member in order to access the information. And the resource list that I've written that would be helpful here is the very last one, the Who You Gonna Call Mental Health Resource List. And a screenshot of this list is on the screen. It has some of the emergency or crisis lines at the very top. And then below, it's about a 2-page document. It lists all the employee family assistance plan providers and phone numbers. And what's helpful about that is that when you call the employee family assistance plan, you'll have a couple of options. And if you've never called one, let me just walk you through how it will be. Typically, when you call, there will be a recorded message, so I encourage you not to jump off the line, stay on the line. And there's often an option 1 to get in immediate contact with someone who can provide crisis support. So the people that the Employee Family Assistance Plan have for those crisis lines have training in suicide intervention, they know how to keep people safe, and they know how to develop safe plans. You can also press 2 if you want to set up counseling. And the beauty of these EFAP counselors is that they can help us in at least 12 different areas, from family issues to alcohol abuse, to gambling, to nutrition, to relationship problems, to elder child care and mental health problems. So you're able to book an appointment with a counselor. All of these counselors have a minimum of 4 years of training at least. And many of them are trained in trauma, which is helpful for us because we're exposed to a great deal of trauma in the work environments that we're in. And you can do these counseling sessions either live, so face-to-face, over the phone, or through video. And your boss never needs to know. If you use the Employee Family Assistance Plan from the Provincial Association, the Provincial Association doesn't know either. It's completely confidential. And I want to remind you that you're not weak in reaching out for help. It is exhausting for us to carry some of these burdens, particularly the burden of mental health, on our own, and it's relieving and unburdening to talk with others. We get strategies on how to be able to cope better, and then by talking about it with others as well, it just helps to normalize it, to know that we're not the only one. So what I'd encourage you to do is after this webinar is over, do go on to the CVMA website under the Practice and Economics section and download the Who You Gonna Call mental health resource list and add your own numbers to that list. Because often if you're like me, when you think about calling, by the time you find the phone numbers, either you're too afraid or you're too doubtful of calling. So having ready access to the phone numbers makes it easy, that it's right in front of you. So just going back to these warning signs, I showed you these 4 categories of warning signs, and I really had to pick and choose what I put on the slides because the list of warning signs can be so long for each category. And human beings are creative. They're going to come up with their own warning signs. And having thoughts of suicide doesn't change that fact. In fact, people with thoughts of suicide might even be more creative. So a person with thoughts of suicide might give us a warning sign that is uniquely their own, and it can be quite subtle and easy to miss. Now, on the other hand, it would be great and helpful if people with thoughts of suicide told us in very direct and open ways. And for this example, I think about the movie Rocket Man, which, and I'm not embarrassed to say I saw Rocket Man a couple of times this summer. And there's a scene in the movie, and it's based on real life for Elton John, where he was up in his hotel, his room in his Beverly Hills mansion, drunk. He took handfuls of Valium, comes down to the pool where there's a party going on. He walks onto the diving board. He walks to the edge of the diving board, and then he says for his final act, I will take my life. And he jumps off the diving board and lets his body float to the bottom of the pool. And fortunately, there were enough people around that they were able to jump in and save him and bring him out of the pool. And in real life, that was his second suicide attempt, and it catapulted him into therapy to get the help that he did need. So he was very direct in his telling. There was no doubt that he was thinking of taking his life and he was ready to suicide. It would be great if all people with thoughts of suicide could be that direct. I'm thinking about suicide, about killing myself, and I need help to not do that. Indeed, some do that, but most don't. So on one hand, it can be hard to pick up the warning signs of people and make us curious that maybe suicide is on their mind. On the other hand, there are things that get in our way that prevent us from being completely open and alert to the warning signs of suicide. And it can be that we just don't connect with suicide. Suicide's not on our radar. We don't think about suicide, so it's really hard to think that other people might be thinking of suicide. Maybe we think that suicide is rare, which we know from the data it's not. In the veterinary profession, 1 in 5 veterinarians and RVTs are thinking about suicide. Maybe we think it's just the way the person is. That person is acting out or being overly dramatic. That's just how they are as a person. Perhaps we think suicide only happens to certain types of people, but if we think that, and I think the media tends to socialize us to thinking that it's marginalized people, for instance, that are more likely to have thoughts of suicide, then we can miss all these other people that don't have those characteristics, and they may have thoughts of suicide. And then we might mistakenly identify people who have these characteristics as having thoughts of suicide when they don't. We can be afraid. We can be afraid that we don't know what to do. We don't know how to help. Maybe our mind goes to, well, we're not trained mental health professionals. How can we help? But I'm really hopeful that through this webinar today, you'll see that we do not need to be a trained psychologist to be alert to warning signs, to ask someone if they're having thoughts of suicide, and then if they say yes, to connect them to someone in their community to help keep them safe. And it could be that we have our own troubles. We know there's a high rate of emotional exhaustion and burnout, and compassion or empathy fatigue in the veterinary profession. And perhaps we just don't have enough capacity to lean in and really recognize those warning signs, have a conversation with that person, and then connect them to safety. And you don't need to do that. If you do recognize that someone has warning signs of suicide, help connect them to safety, and then you get the help that you need. So with suicide, there's a lot of taboo and there's a lot of myths and stigmas still out there. In fact, sometimes it's hard to even say the word suicide. So often people have questions about suicide that they may be afraid to ask or they don't know who to ask. So I'm going to be brave here and ask these questions for you and answer them so that we can let some of these assumptions or myths go and see them for what they are. So perhaps you're thinking, well, asking someone if they are feeling suicidal put the idea in their head. The evidence and the experience says no. It actually reduces the likelihood of suicide. First off, people are just not that easy to influence. Secondly, if you've picked up on warning signs that they're giving you, then they've likely already thought about suicide and you're not going to plant the idea. It also shows the other person that you are a person who notices things, you care, you have the courage and the confidence to be able to ask the question, and even if it's not suicide, you're letting them know that you're a person that they can talk to, that you take things seriously. And a related question, sometimes people wonder, well, if I talk to someone about suicide, will it put the idea of suicide in my head? And again, the evidence and the experience says no. Another myth is, well, shouldn't we mind our own business and not ask about suicide? And we're being nosy by asking about suicide, not because we want to gossip about that person, but because we care. We want to know. It's a matter of life or death. So this question is an important one to ask. And the last myth is, won't asking about suicide make them angry? Likely not. Likely they'll recognize that you are a person who cares and you're reaching out to ask them because you want to help keep them safe. If they do get angry, well, that's okay. You need to ask them. You can't avoid asking the question because it's a matter of life or death. We need to help keep them alive. And up to this point in time, we've talked about the warning signs that may indicate that someone is having thoughts of suicide. We talked about how things get in the way of us being alert to those warning signs. And hopefully now you can debunk some of those myths and be really present that if you do see warning signs, that you want to be able to ask. So let's move on and find out how we can ask that question. And this slide shows one of the ways, and it's a good way to ask the question about suicide, and it has three important parts. The first is to let the person know the warning signs that you have seen. So withdrawing from friends and family, talking about not making a difference anymore for clients and their animals, and looking really sad. And by saying these things, you're letting the other person know that you are aware, you notice things, and that you are letting them know what you have seen or what you have heard. You're honest labeling them, that you are naming these warning signs. And then notice the word sometimes. Sometimes when people are withdrawing from friends and family, talking about not making a difference anymore for clients and their animals, and looking really sad, they are thinking of suicide. So that word sometimes gives some wiggle room. Not all of the time, but sometimes these warning signs are connected to suicide. And that's the second point to this question, is that there's context. You're just not asking the question, are you thinking of suicide, out of the blue? You're giving the person the rationale, the warning signs that you've picked up from them. And then the third important thing about asking this question is using the word suicide. It's a hard word to say, but we can't mince words. We can't tiptoe around this. Because if we say something like, are you thinking of harming yourself, then that person might think, gosh, Kathy can't even come out and ask me. She can't even use the word suicide. So I don't trust that I can speak with her. I don't trust that she even is comfortable hearing the answer if it is yes. Likewise, we can't dismiss what we're seeing. We can't say something like, you're not thinking of doing that again, are you? Or you're not thinking of doing something silly, are you? We have to come out and say, are you thinking of suicide? So I'm going to give you an opportunity to try on saying this question in your head. And before doing, I'm just going to give you one way that you could ask the question. Sometimes when people are thinking, withdrawing from friends and family, thinking about not making a difference anymore for clients and their animals and looking really sad, they're thinking of suicide. Are you thinking of suicide? So as you ask the question in your head, think about how you are saying it. Are you saying it in a way that is genuine and that will evoke a true response? So go ahead, just try saying it silently to yourself. So how was that? It likely felt awkward, and that's okay, it can, the first time you do it. Really, all I want is for you to feel that this is doable, that you were able to ask the question in your head. Now, if someone does say yes, then now we're at the point where we need to connect them to safety. And one good way to connect them to safety is to ask them about their supports. What resources do you have to support you, or who do you think you could turn to for safety? So you're really doing suicide safety with them. And if they don't have anyone they can turn to for safety, then you have the direct suicide support line. You also have the employee family assistance plan that you can call with them and press 1 to get connected to direct crisis support. Now, if it is an emergency and the person is talking about harming themselves or harming others or has access to lethal means, do call 911. Do not get involved if the person is threatening or if you feel personally unsafe. Call for help. Stay with the person, but just observe them from a safe distance. So this is great. Like, we have done the 3 key steps to becoming more suicide alert. We've gone through the warning signs of suicide, that if you see or hear or pick up those moods, or you know risk factors in that person who that may put them at risk for suicide, then now you have a way of asking the question. And if they do say yes, connect the person with thoughts of suicide to someone who can keep them safe by using the Who You're Going to Call resource list. And what this webinar provides is more eyes and more ears on the ground in veterinary communities who can help keep each other safe so that we don't have colleagues falling through the cracks to suicide. The information you're learning in the webinar will help keep people who are important in your life safe from suicide, and it might even be your own life that you save with this information, because we all deserve to live. So there are 3 things I need you to do at the end of this webinar, and you might want to write these things down on a piece of paper or capture them in your phone. The first thing I need you to do is to be more suicide alert in your community to those warning signs. The second is to download and then post the Who You're Going to Call resource list in your veterinary clinic. And then have at least one person in your clinic take the Safe Talk Suicide Awareness Workshop. So what I've taught today is just the truncated version of the Safe Talk workshop. I am certified to teach it. But to take the Safe Talk workshop, it's only 3.5 hours of your time. You'll learn more than what you learned today. You'll watch a number of videos depicting alert and non-alert helpers. You'll get a better understanding of the myths and misconceptions of suicide. You'll get a lot more chances to practice safely. And you'll be able to get lists of more local community resources. So you can do one of 2 things. If you're in Alberta, you can sign up for an open enrollment course at suicideinfo.ca. If you're in other provinces, you can go to livingworks.net to sign up. And my vision would be, over the years, that we get at least one person in every veterinary clinic to have attended this 3.5-hour course. Just like we have certified physical first aiders in veterinary clinics, we'll have someone who is certified to be a Safe Talk Alert suicide helper. not only can you do open enrollment courses, but if you are interested in getting a cohort of veterinarians together, then do reach out to your Merck territory manager. They may be able to help guide you on some of the logistics of having a veterinary-specific Safe Talk course. And now I just want to end with the fact that this webinar kicks off as a kickoff event or launch event of the inaugural It's Time to Talk About Mental Health and Veterinary Medicine Week. And this is a week that was initiated cooperatively with Merck Animal Health and the Canadian Vet Medical Association. And I would encourage you to carry on this conversation. We need to talk about mental health and veterinary medicine. It tends to be a silent disease. There's a high percentage of us who do have either suicide ideation or clinical signs of depression, anxiety, burnout, compassion fatigue. And even if you are not one of those people, likely you know someone who does, or you will know someone who does. And stigma is one of the biggest obstacles that get in the way of talking about it. So by talking about our mental health, then we can normalize it and we can help create a culture where there's people caring for each other in the veterinary community. And I know how exhausting and tiring it is to feel like you have to be strong all the time. I would not be at the point I am in my life today if I hadn't reached out to my general practitioner in 2012 to talk about my anxiety disorder and that it was getting the better of me. And she helped to normalize it by talking about her own anxiety. She talked about the value of going on selective serotonin reuptake inhibitors because of brain pathology where serotonin does not hang out long enough in synaptic clefts. And although I was hesitant to take medicine, I did, and I continue to take a selective serotonin reuptake inhibitor since 2012 because it just helps me show up to my self-care in a more honest and consistent way. It helps me stabilize my moods so I can be a better person for my friends and my coworkers and my family members. So just to say, don't feel like you're going to be labeled if you do reach out for help as being lazy or that you should just be able to pull up your socks and soldier through it. It's okay to be vulnerable and talk it through with others. It helps to make it feel better because you're spreading the burden to others or spreading the normalization of mental health issues to others. And it lets other people know that it's okay to talk about it. And if you do need additional resources, like I have, I've used the Employee Family Assistance Plans many times over the years, you've got the Who You Gonna Call mental health resource list. So do print that out at the end of this webinar. So with that, I come to a close. I'm so grateful that we had this shared experience to talk about heightening our suicide awareness skills. Now you have more information on the warning signs of suicide. You've got the ability to ask the question in an effective way. And if you do find out that people have thoughts of suicide in your local veterinary community, then you have your resources, the community resources that you can connect them to help them stay safe and keep safe. So I'm very happy that a number of us joined the call tonight because we'll have, as I mentioned, more eyes and more ears on the veterinary community ground to look after each other and that the life that we all save could even be our own. So I'm going to stay on the webinar for another 10 minutes, and I'll ask Laura if she can just come off mute and let me know if any questions have come on the chat line that I can answer.
Hi, Kathy. No questions have come through.
Okay, thanks, Laura. Oh, Lori's raised her hand. I don't quite know what that means. Maybe she'll have a question. Here, you know what I'm going to do? I'm going to stop sharing, and what I'm going to do is take people off mute. So if they want to ask a question, they can. 1 second here. I'm going to unmute everybody. So you can either ask the question in the chat box, which is over in the right-hand corner of your screen, or you're now all off mute, so you can ask the question if you do have a question. Very quiet out there. You'll
Hi,
notice
Kathy.
that on that. Oh, hi.
I did have a question. I wanted to type it in, but my chat box isn't showing up, so I'll just ask it.
Oh, okay.
I'm just wondering if anxiety versus depression, if anxiety in itself is considered a risk factor.
Yes, it is. It is considered a risk factor for suicide. It's not as high as, say, depression or substance use. So depression is number one, substance use or abuse is number two, but anxiety would be on that list of mental health conditions as a risk factor for having thoughts of suicide.
Great, thank you. And sorry,
You're
just
welcome.
one other question.
Yeah.
Are there always signs? Will somebody always exhibit some sort of signs if they have suicide ideation, or does it sometimes just happen and you just have absolutely no idea that they were thinking that?
Well, that's a good question. It's an intuitive question because there are these so-called impulsive suicides where it looks like someone went from having thoughts of suicide to suiciding in what seems like a really short length of time. However, when those situations are analyzed or reviewed, there were warning signs, but sometimes they're so subtle and they're very easy to miss. And again, human beings being who they are and what they are, they can be creative. So some of those warning signs can be very subtle and easily missed. But the impulsive suicides are very rare. Most people with thoughts of suicide will show warning signs within those categories that I spoke about. One thing I forgot to mention, actually two things. On that CVMA website where the Who You Gonna Call resource list is posted, I've written some other resources, including signs and symptoms of suicide, so a good checklist of warning signs. I've written signs and symptoms of common mental health conditions, and I've also written an overview of signs and symptoms as well as risk factors for compassion, burnout, and empathy fatigue. So I invite you to go to that portion of the CVMA website and download those resources. This video or this webinar is being recorded, and the recording will be posted later this week on that section of the CVMA website. I see that Lori raised her hand, and Lori, do you have a question? Are you on mute? I can try to unmute you. There you go.
Yeah, I did. I asked my two questions.
Oh, good. Okay, that was you, Lori. Okay.
Thank you.
All right. You're welcome. And then the other thing, if you want to continue the conversation with me afterwards, I'm more than happy to do that. I can be reached at Kathleen.Keil, so that's Kathleen, Keil, Keil, at Merck.com. And remember that I am trained in suicide intervention, so I can help keep people safe from suicide and also help them to create a safe plan. I'll just put my email address in the chat function. There we go. Okay. Well, if there's no further questions, I am so appreciative that you've joined. I'm really honored that as many people joined to talk about suicide and suicide awareness in our profession. And I just wish you all a remaining safe and healthy World Suicide Prevention Day. So thank you for joining. Bye.